Therapy to medical practitioners for over 20 years. He is the innovator of Ozone Therapy, a method of rejuvenating degenerated joints using ozone injections. He has published 2 peer-reviewed papers on the use of ozone in clinical medicine. He is the founder of the Nevada Center of Alternative and Anti-Aging Medicine in Carson City, Nevada, which is devoted to the prevention and treatment of aging and age-related diseases by improving mitochondrial efficiency. He has developed and pioneered the first method to measure mitochondrial efficiency in a clinical setting. Please give a warm Academy welcome to Dr. Frank Shallenberger.
Thank you. Well, once again, it's a pleasure to be with this group and so many people I know, and it's just a great camaraderie, great group. Thank you, Rich Fisher, for inviting me again, and all the organizers for doing a marvelous job. We've got some 300 people here. How good is that? Also, I want to thank them for putting Jerry Tennant on before me, because he sort of set me up now. He set me up. There's just so many similarities between what he had to say and what I'm going to say. So it's all working out exactly as I planned it. Let me see here. Now, how do I get out of here? Except for this part. Let's see. That's not it. Okay. Yeah. All right. So okay. We're going to talk about Lyme disease, but I think you'll see that in talking about Lyme disease, I'm really talking, like Jerry was, in kind of general terms in a way, about how to approach disease, maybe how to prevent disease as well. So this is the only time I've given a talk where I had a cross out on the title. Successful treatment for chronic Lyme disease. I've changed that to syndrome. I don't believe chronic Lyme disease is actually a disease, an infectious disease like most people think, and I'm going to make a case for that. And I'm also going to make a case for why that's so hard to treat. Because most people, certainly pretty much every infectious disease expert out there, thinks that chronic Lyme disease does not exist. Why? They can't find anything to treat it with. Despite they can find antibiotics to kill the supposed organism, they can't find anything to treat it with. So I think it's more like a syndrome, so I'm going to make a case for that. There is a difference between acute and chronic Lyme disease. There's a lot of differences. Acute Lyme disease is an infection caused by an identified organism, Borrelia burgdorferi. Chronic Lyme disease does not have any identified organisms. It's also characterized by some classic clinical findings. You've got your classic bullseye rash, you have acute-like viral-like symptoms, and comes on rapidly. It happens after tick bite. It's pretty readily identified. Either they bring in the tick, or you can do acute titers for Borrelia. It's pretty easy to find. And it's pretty much, as far as I know, close to 100% successfully treated with antibiotics. Chronic Lyme disease is a whole other deal. Different. It comes on years after the infection. Now, that's not typical of an infectious disease at all. That's unusual. It is not easily diagnosed. In fact, it's almost impossible to diagnose chronic Lyme disease. That's not typical of an infection. I won't say very rarely, but I want to say that it does not usually respond to even the most aggressive antibiotic therapies. I've seen patients come in, and you've probably seen them too, after 1-2 years of aggressive intravenous, multiple oral antibiotics. And if they're any better at all, it's just a little bit. That's usually the case. And I get that incidentally from many of the docs that use that therapy. That's what they tell me. Also, unlike any kind of other infectious disease, it mimics all kinds of other diseases. It doesn't come as like the acute Lyme disease. Here's your presentation. That's what it looks like. It's like a typical infectious disease. This isn't like that. It can mimic all kinds of other diseases, and and that often people with chronic Lyme are misdiagnosed. I have to say that up until just even a couple of years ago, I didn't actually believe in chronic Lyme disease. I thought it was something else. And my reason was based upon all these things right here. And now that I'm a staunch believer, and the reason I am, I'll explain to you in a little bit, but the reason I'm a staunch believer now is and now I'm worried about so many people out there that have been misdiagnosed and are getting treated inappropriately. They've been misdiagnosed with other diseases, which we'll talk about. Okay, that's my point. Chronic Lyme disease may be extremely common. For one, I look back on my practice and I think I've missed probably thousands of people that have chronic Lyme disease. Why? Again, the diagnostic tests are usually negative. Even in patients with known chronic Lyme disease, in other words, we know they had acute Lyme disease, the titers look like they have chronic Lyme disease. The onset was close enough to attach that. Even with patients known like that, the tests are more than 50% negative. Most authorities think that chronic Lyme disease begins with acute Lyme disease. But less than half of the cases of documented Lyme disease report either a tick bite or a rash or anything. Half of the documented cases don't even have any history of a tick bite or any history of a prodromal illness or anything to do with it. So you could have a patient that just comes up with multiple sclerosis, that diagnosis, no history of Lyme, no history of living in the Lyme epidemic area, no history of tick bite, none of that stuff. Could be chronic Lyme disease. How do you know? There's no way to diagnose it. So if you start thinking about it, you start understanding, anybody that comes into my office with some weird stuff, I better think that way. Most infectious disease specialists, dang near every single one of them, do not believe that chronic Lyme disease even exists. But it is common. According to preliminary statistics just released in last year by the CDC, Centers for Disease Control, approximately 300,000 new cases of Lyme disease are diagnosed in the U.S. each year. People out there worried about Ebola. I think this is a lot worse than Ebola would ever be. This is about 10 times higher than the officially reported number of cases, indicating that the disease is just vastly underreported. Of course it's vastly underreported. How can you report something you don't even know what it is? Medical News Today commented on that data presented at that conference. And they said this agrees with the studies reported in the 1990s that showed that actual number of Lyme disease cases in the U.S. was likely to be 3 to 12 times higher than reported. So it's an extremely common problem. There's a lot of diseases that present as a result of chronic Lyme. Just multiple sclerosis, Bell's palsy, Parkinson's, chronic fatigue syndrome, fibromyalgia, ALS, ADHD, dementia, autoimmune diseases, depression, neurosis, rheumatoid arthritis, colitis, irritable bowel syndrome, epilepsy, chronic mold toxicity, optic neuritis, and ADD. Start thinking about this anytime you have those patients come in to see you with those mysterious cyclical or migrating symptoms, the numbness that shoots throughout the body, the shocking pains that show up here one day and here another day, and then they're fine on the third day, and then it does something else on the fourth day. They're not mental cases, I'm pretty much convinced. Those are probably chronic Lyme. They can be fairly mild, so they can be fairly mild symptoms, or they can be extremely debilitating, even to the point of death. I had a patient with chronic Lyme die not too long ago from cardiac complications. So it really runs the gamut. Symptoms are all over the place. Muscle joint pain, very common. The neurological symptoms, extremely common. Almost every patient I see has predominance in neurological symptoms, and that's important because the treatment in that respect is extremely important. You could have seizures, very common to see numbness, tingling, weird pains shooting throughout the arms, vibrations. How about those patients that come in and tell you they got vibrations all over the place? Can be all the extremities throughout the body, torso. They often have impaired memory. It's very difficult to get history from them sometimes. To keep them on point, keep them on target, it's really nice to have somebody else to come in with them so that you can ask that person what's going on, because a lot of times they have a very difficulty telling you what they're going through. Tinnitus, vertigo, lightheadedness, a lot of mood disorders can present. They come along with this problem. Now, rarely do I think that depression all by itself, chronic depression all by itself, is chronic Lyme, but I will tell you for absolute sure that if you have chronic Lyme, the odds on you having some sort of mood disorder are extremely common. Fatigue is a hallmark. Insomnia, incredible insomnia. We see that a lot. Heart arrhythmias and heart failures, pretty uncommon, but they can happen. Low-grade fevers, the hot flashes, the night sweats, and at first you think it's hormones, but then you realize there's something else going on here. Vision, hearing problems, swollen lymph glands, chest pains, palpitations, uncommon, jaw pain, fairly uncommon, testicular, pelvic pains, fairly common. Pelvic floor dysfunction can be chronic Lyme disease. Migraines and headaches, incredibly common. So that almost always goes with the territory. And often the entire workup is negative for any identifiable condition, and the patients are typically told, what most patients are told, it's all in your head. I've seen patients who have almost all of these symptoms: the pain, the numbness, the mental confusion, the depression, the migraines, almost all of those problems, the colitis, almost all of those problems, all at the same time. So they can be really messed up. Most of the people I see these days are on disability. Chronic infections, in quotes, are not really infections. I want to make the case for this. Chronic infections are not infections, at least not in the way we think of infections. You think of an infection as being something where a certain microbe causes a certain constellation of events. You kill the microbe, the events go away, end the story. That's an infection. Chronic infections don't act like that. They generally don't respond to antimicrobial therapy, no matter how much you throw at them. It doesn't work. Many completely asymptomatic people are infected with the same organisms that cause chronic infections in others. It is so common. Like HPV, human papillomavirus, it's supposed to cause cervical cancer. How many women in studies are carrying around HPV in their vaginas? 78%. 78% of the women in this room are carrying HPV around. Now, how many women actually end up with genital warts or any complications of HPV? Like, very few. So this is not an infectious disease. And it won't respond to all that silly therapy they have out there that's directed at HPV. HCV, hepatitis, same thing. Hepatitis C, exact same thing. 70% of people that have positive HCV titers never go on to have problem 1. They have huge viral titers in their blood. They never have a problem. That's just not like an infection. Herpes, CMV, strep. How many times have strep throat run through a classroom? And what? Maybe 20, 30% of the kids run down with strep throat. What happened to the other 70? It's just not an infectious disease the way we think about it. Candida and Borrelia. Chronic infections become chronic because of an inability of the immune system to control the organism. Dr. Tennant was basically telling you this last hour. Basically, the repair systems are broken. Our bodies were designed with repair systems. Something breaks down, we repair it, we fix it. It's not like GM Motors. Breaks down, you got to take it into somebody. We actually fix the stuff as it breaks down. It's an amazing design. What happens when those repair systems don't work? We don't repair. It's exactly what Dr. Tennant said. This is the issue. This is the issue with, quote, chronic infections. They're not really infections, they're broken repair systems. Now, how could that work? It could be related to the organism's ability to evade the repair systems. Could be that. Some people say that. There's some researchers at Yale who say that there's residual proteins from the die-off of the acute infection that stay in the body, and that's what's causing the chronic Lyme situation. It gets complicated, of course, with the bug itself. It can exist in 3 different forms: cyst, spirochete, and L form. These forms can evade antibiotic exposure. There are 5 subspecies of Borrelia, more than 100 strains in the U.S. and 300 worldwide. Pretty hard to come up with antibiotics, going to hit all those. Many of these strains have developed chronic resistance, so that makes it even harder. And then there's all this co-infections. There's lots of other co-infections. So this just does not fit the model for chronic infection. It could also be due to a faulty immune system. That's your repair situation. Chronic infections create an autoimmune response. It's my belief that all autoimmune diseases are caused by a, quote, chronic infection, which is not an infection. It's different. Chronic infections create multi-system imbalances. That's why these Lyme patients, for example, have all these weird things going on with all these different systems. It's just not one thing that you normally see with a regular type of infection. Co-infections, there's just often too many to count. If in the early days they used to test for antibodies to all kinds of things, to all kinds of viruses, just candida, the whole deal, parasites, whatever. And I noticed in the really sick people, they're like 70% of these antibodies were positive. And I thought to myself, that poor person can't be so lucky as to have like all these bugs. Turns out that's not the problem. We all have the bugs. Except the ones that don't have the problem have repair systems that are working properly. That's the difference. It's not the bugs. You can kill the bugs all day long. Won't do anything. You need to have the repair systems that repair the damage done by the bugs. Now you got something going on. Of course, antimicrobial therapies don't correct any of that stuff I just talked about. So no wonder they fail. You're shooting at the wrong target. The solution, I've learned, is a comprehensive multi-phase approach, similar to what Dr. Tennant was just talking about. You have to repair the repair systems. Once the repair systems get back in place, patient gets better. I've treated many patients over the years for Lyme disease, and you know what? I never did a very good job. And I kept on thinking we'd do something, but I kept on thinking it was an infectious disease. I use ozone a lot. I'll talk a little bit about that. I use ozone a lot. Ozone kills just every microbe you put it under. And so I thought, this would be pretty simple. I'll just, give them a lot of ozone. It doesn't work. It doesn't work. And that's one of the reasons I thought Lyme disease doesn't exist, because how can it exist if ozone doesn't work? Should be killing it. But you'll see why here in a second. Okay, so see if I got this. Yeah, okay, so about 6-7 months ago, at our annual American Academy of Ozone Therapy conference, Dr. David Minkoff was there. He presented 3 cases of chronic Lyme disease that he successfully cured using a very aggressive approach with ozone. But there was a whole lot more. And that really opened my eyes. He heavily focused on the nutritional status of the patient. He heavily focused on the gastro-intestinal aspects of the patient. He heavily focused on parasitic issues. He focused a lot on heavy metals. He focused a lot on stress, mental attitudes. Just like Dr. Tennant was talking about, all these various factors, he focused on all of them. And he had absolutely astounding results. And then, I'm listening to him talk, and I'm thinking, that's why I don't do anything. I'm thinking infectious disease. I got to get my head out of that. So I went home and I developed a system that actually treats it as a multi-system disorder and no longer focuses on this whole idea of infectious disease. In other words, I'm not thinking about trying to kill microbes. I'm trying to think about repairing the systems that are down that makes it unable for this person to heal well. So you could throw the protocols out. Each case is individual because the repair systems that are broken in that person are okay in that person, but this person's got different repair systems that are down, and they might have some similarities, but you can't just run it through a mill. This doesn't work that way. You got to actually sit down and spend an hour or two with the patient and figure out what's going on in each individual case. Eventually it comes down to seven issues that you can focus on. This is what I'm focusing on. Some patients are going to require treatment in almost every single one of these areas. But here's the deal. I've treated about 8, 9 now chronic Lyme disease patients since that talk. These were serious cases because that's all I get. But every single one of them had had antibiotic therapy, most of them for years, intravenous antibiotic therapy for years, in many cases costing them over $100,000 to do it because insurance doesn't typically pay for it. That's how good the antibiotics were with these guys. They were a mess, every single one on disability. Okay? Every single one of those patients was well within 4 to 6 weeks with this protocol. I'm 100%. I'm batting 100% right now. Thank you. Okay, so here's the approach. Immune system dysfunction. Obviously, there's something wrong with the immune system. They have all these autoimmune phenomena. Something's goofy. Focal disturbances. We'll talk about that. Scars, infections. Adrenal function. Huge. Absolutely huge. I'm glad Dr. Tennant brought that out. You don't fix that, they don't go well. In fact, if you miss one of these things, they're probably not going to get well. If you're treating a patient with chronic Lyme and they don't get well within 4 to 6 weeks with this thing, you're missing something. That's my theory. Metabolism, gigantic. Once again, that's the thyroid issue, but we'll talk more. Neurotransmitter imbalances, I can't say enough about this. Probably, that's pretty close to the top of my list here, almost in terms of importance. And yet, most doctors don't have a clue about how to do this. So we're going to talk about that. Hormones, and then, of course, toxicity and heavy metals. So these are the sorts of things I'm going to run through with you. Okay, for immune system dysfunction, what do? I use ozone therapy. Ozone therapy has been shown to be absolutely remarkable in modulating and normalizing immune system therapy by modulating cytokines, and also by in just a lot of ways. So I'm not going to even get into all that, but I do encourage you all, especially the dentist, but any practitioner that's treating patients, if you don't know about ozone therapy, if you're not using this in your clinic, you're not giving your patients your best. I'm sorry, but that's just the news. You need to know about this. So I invite you to come to the next AAO meeting, which is going to be the weekend after Valentine's Day. There are some cards out on the table, and I brought a bunch of my newsletters also too, and the latest version was some stuff about what we just had at our last convention. So I recommend that you attend that and start learning about ozone therapy. It's absolutely unbelievable. You can do it as major autoimmunotherapy. Recently we've been doing it as direct injections of ozone gas right into the vein. Sounds pretty weird, but it can be done. We're using a very aggressive approach with ozone. So anywhere from 60 to 100 cc's of ozone gas at 40 gamma. And then we're using it in a very strange way too. We're combining it with glutathione. Now, in a way, you might think, well, yeah, the patient's going to be glutathione deficient, so that makes sense. But do you realize that if you talk to any ozone expert internationally anyhow, they'd say, oh, no, you never mix glutathione with ozone. You can't do that. They counteract each other. You never mix vitamin C with ozone. They counteract each other. You can't do that. In fact, on the day you get ozone, you can't take any antioxidants. You can't take beta-carotene, you can't take vitamin E. That's just a principle. It's bogus. This just doesn't pan out clinically, I'm sorry. Just doesn't pan out clinically. I used to think that. I have to change my ways because now I'm giving ozone with glutathione and seeing absolutely astounding results. So we give them 1,000 milligrams of glutathione right in the middle of the ozone application, and we do that twice a day. Twice a day. That's a lot. That's aggressive. In the morning, in the afternoon, bang, bang, bang. Not 12 hours goes by. They're not getting hit with this procedure. But that's not all. That's just ozonating the blood. We ozonate the colon. A lot of diseases start in the colon. A lot of issues. A lot of the repair systems don't work because of problems in the colon. That's not enough. If you give ozone as a sauna, it affects the dendritic cells in a way that's very immune stimulating. So we use saunas. We shoot ozone gas right into the rectum. We call that rozone. You can have fun with the words a little bit. You don't inhale ozone. It's very toxic. That's the one thing about ozone. You probably know this. You just don't inhale it. It's very toxic, okay? So ozone inhalation therapy means you bubble the ozone up through olive oil. This creates vaporized terpenes. It's not really ozone. And you inhale these vaporized terpenes. And it's absolutely remarkable for sinuses, for pharyngitic issues, and for lung problems. And then you can take ozone and put it into the ears. I really don't know why this works so well. People just told me it did, so I tried it, and it does. So I don't have a good explanation for that. But if you came to my office, you got your ears going, you got your lungs going, you got your rear end going, you got the blood going, you got your skin going. It's like, when is this going to stop? And your immune system will be highly regulated. You will no longer get sick anymore. Jerry touched on the whole idea of focal disturbances, which is really huge. The naturopaths will tell you 100 years ago, all the diseases start in the GI tract. I'm convinced that's true. I also think mouth is right in there, and sinuses are right in there, and scars. And in the concept of scars is not just the surgical scars in the skin, but the injuries. Jerry at the break was talking a little bit about somebody that injured their knee when they were 6 years old, and how he could see the constellation of events that ultimately, caused them to have a disease later on in life. So any kind of injury, a lot of fibromyalgia cases, a lot of them start with a whiplash injury. This may be chronic Lyme. A lot of your fibros may be chronic Lyme. So we're going to run through these. Okay, so for gastrointestinal symptoms, Candida's right up there. So, as far as I'm concerned, everybody that sees me for any kind of chronic disease has a yeast problem. So they all get treated aggressively for yeast. For those of you that are doing this, I use terbinafine. I don't use the standard medications because they just don't seem to work. But if you haven't tried terbinafine, try terbinafine, 250 milligrams once a day for 3 weeks. It's pretty remarkable. I think a lot of the other medications like diflucan and so forth have the yeast bugs are resistant to these most of the time. Sorry? Say what? Everybody's talking at once. What? Oh, terbinafine. Thank you. Terbinafine. Once a day, 250 milligrams, once a day for 3 weeks. Zero carbohydrate diet, by the way. None, nada. And you throw your probiotics in there, only works 100% of the time. Antiparasitic therapy. Dr. Simon Yu has really taught me this. And he has a very cool protocol for every full moon. For 3 days, you give these antiparasitic drugs. They're entirely safe. I've never seen a problem from them. You knock the parasites out. Intestinal restorative therapy, that'd be like your probiotics and such. The ozone hydrocolonic therapy, obviously, very, very influential in the GI tract. I love colonics, even without the ozone. They're very, very helpful to help people heal. But with the ozone, it's almost not fair to the poor old critters. Biofilm therapy. As you probably know, bugs can hide under these films, these mucoid types of films, and evade ozone, evade antibiotics, invade your own immune system. So they hide. You can't find them. You got to get rid of the biofilms. Ozone's an unbelievable way to get rid of biofilms. So you're drinking ozone water, you're drinking ozonated olive oil, you've got ozone going up the other way, you've got ozone going in your blood, you're knocking out the biofilms in the plaque. And there's several really good herbal remedies, amongst them hydrastis and oregano. You get the right tinctures of these herbal remedies. A number of the herbal companies sell really strong biofilms. It might, biofilm treatments, it might take 4 to 5 months to get rid of the biofilm. But here's the deal. If you treat somebody for yeast and they get better, as they will, 100%, right? And then they come back 3 months later and they got yeast, you better be thinking biofilm. That's why it's coming back. You only got some of it, and now it's coming right back again. So think biofilms. Because the GI tract is broken down, very often they have food allergies that are stimulating problems, so you got to figure out what they're allergic to, take that out. Once they're well, they can have the food back. If you haven't used the blood type diet, it'd be something for you to consider. It's what would I say, maybe it's 65-70% effective for almost any autoimmune disease without even doing the testing. Just find out what their blood type is and put them on the blood type diet. So I would recommend that. This is the approach we use for all the gastrointestinal sorts of foci. For the dentals, incompatible metals, they generate currents, and as you know now, currents throw everything off. Infections, and all kinds of infections from periodontal to abscesses. Some of these medical doctors can treat. Sometimes you have to refer it out, but if you're like me, you can inject ozone and or blood treated with ozone and or serum treated with ozone into cavitations and around cavitations and gas. All of that stuff you can do, and you can clear up an awful lot of these abscesses and these cavitations. Bite disturbances, and there's probably a lot of other things that dentists know about that I don't, so basically I just send these people out for help on that. But if you're a medical doctor or naturopath, look in the mouth. Take a look around, see what you got in there. Even if you don't know what you're seeing, you can sort of figure out if something looks funny in there and send them out to somebody that knows about this stuff. Dr. Tennant mentioned scars. I would also add to that injuries and areas of chronic pain. I think these are all foci. They're very disruptive to the system. You have a bad enough scar, you have a bad enough chronic injury like a whiplash, you don't fix that, you don't get better. It's that simple. So you can, usually by the time the patients see me, they've already had the osteopathic chiropractic type of work. Prolozone therapy is pretty much a must. You have to know this. You can take away almost any chronic pain with prolozone therapy. It's a mixture of neural therapy and ozone therapy. And we teach that regularly, and it's just astounding. Any of you guys that have used this, you know what I'm talking about. You'll take a person that comes into you with a chronic pain of 20 years duration, maybe 4 or 5 surgeries later, and in 20 minutes, the pain's gone for the first time in their life. And with repeated treatments, it never comes back. I don't expect you actually to believe that until you try it yourself, but it is amazing. Neural therapy, you can throw that into the situation, and we have one of these PEMP devices. I rarely use it because prolozone therapy fixes everybody all the time anyway. But if you have one, that's one of the approaches that you could do. For scars, you inject scars. using the neural therapy technique. Sinuses. Now keep in mind, as we go through this, a lot of these patients need everything I've told you. That's why they get better. You miss something, you might miss your opportunity. Chronic sinus infections next to teeth. First, number one is the GI disturbances. Number two is the dental disturbances. Number three is the sinus. If I have a patient with chronic Lyme come in and tell me my gut is absolutely perfect, I have absolutely nothing wrong with my teeth, and I never get sinusitis, I am really surprised. It just typically doesn't happen. Sinuses are a big problem. Antibiotics do not kill sinus. Chronic sinus infections are never alleviated with antibiotics. They're just worsened. The Mayo Clinic published recently, proven 97% of chronic sinus infections are fungal. They got nothing to do. Yes, for some reason they get better when you give them an antibiotic. I'll give you that. But they could just come right back. That's why they're chronic. Ozone, when it's properly used in the sinuses, 100% clear up chronic sinus infections. Once again, you can have patients that have had a chronic sinus issue for years and years, and I'll fix them in a month and a half with repeated injections. You can actually shoot ozone right up, the ozone gas right up into the nose, right into the nasal cavity. You can take 20 to 60 cc's of ozone gas at 20 gamma, put it in the nostril, squeeze the nostrils, shoot the gas right in there. Do it to the other side, do that a few times. Unbelievable what's going to happen, what's going to come out, what's going to drain out, and how well these patients can get, even with severely chronic problems. Inhaled ozone therapy, and once again, that's the terpenes. Nebulized hydrogen peroxide. This is not ozone, but this is an absolutely astounding therapy. You just take a nebulizer. You take a 100 cc bag of normal saline. You put 5 cc's of high-grade pharmaceutical type grade of 3% in that bag. So 5 cc's of 3% hydrogen peroxide in a bag of 100 cc's of normal saline, and then you nebulize that. You nebulize it for 5 minutes, you can nebulize it for an hour, you give it to little babies, it knocks out colds and flus, and that's the practical aspect of it. But it's also very helpful for patients that have issues with the sinuses and the back of the throat and the lungs and such. Antifungal medication, if I've got a chronic sinus thing, you can bet they're going to be on yeast and terbinafine. Absolutely. Antifungal sprays, Hydrastis does really well there. Oregano burns, so you got to be careful. And so there are certain things that you can inject back into the sinuses that have an antifungal activity. But you've got to clean the sinuses up. Your patient probably won't get better if you don't. So I can't say enough about adrenal function. I've been doing this for over 40 years now, and I can tell you there have been many occasions that I've had patients that have come to see me that have seen all the famous guys that you've heard about, all the really good guys, all the really good docs that have been around, and they can't get the results. That's why they're seeing me. And I'll fix them in 4 weeks. Because these guys don't understand how aggressive you need to be with the adrenal glands. In fact, I have a dictum. How do you diagnose that your patient has an adrenal dysfunction? You guys know how to diagnose adrenal dysfunction? They're in your office. That's how you know. People outside your office, probably, but you can't be sure. Okay, so you need nutritional support. Basically, I love these herbs: ashwagandha, cordyceps, ginseng, licorice in high doses, vitamin C, pantothenic in high doses, liver extract and adrenal extract. I like them so much I did like Dr. Tennant, and I put them all together in something I call Adrenal Factor, which you could get for your own patients. If you want to try them out, just give my office a call. This thing is just astounding. I've produced or designed a lot of products in my life. Most of them never did anything. They don't really work that great. Good ideas, it just didn't work that great. This isn't one of them. This one works amazingly well. So that's a routine for me, to be on fairly high doses of those herbs. The diet, is pretty simple. This is not rocket science in this regard. No stimulants, okay? No Red Bulls, no coffee, no decaffeinated coffee, no nothing, okay? If they're on a lot of that stuff, tell them to go out and buy some Advil, because they're going to be needing it for a few days when they stop. And a low carb, really, really low carb. No fruit, no grains, no sugar. Okay? Really important. You get the adrenals well, got to do that. And then neurotransmitter therapy, I'm going to touch upon this in a sec. Incredibly important, by the way. DHEA, gigantic doses sometimes. Autoimmune diseases, almost every patient with autoimmune disease will respond to DHEA, from lupus to the whole gamut. But you got to give a lot. You might need up to 200 milligrams a day. And hydrocortisone, same thing. You're going to need a lot. These little 2.5 milligram doses are not going to cut it for most people. In fact, almost nobody's going to respond to 2.5 milligram dose. You need to pump it up. So it's uncommon for me to get up to 100 milligrams a day. But you could easily get up to 30. That's pretty common, 30, 40 milligrams a day. It's amazing. I always check them with ACTHs, right? Just to see what's going on with the ACTH. I don't want to really suppress it, so I'll get their ACTH at a baseline. It will be like 32. I'll give them 20 milligrams of hydrocortisone, check it again, it's 32. I'll give them 30 milligrams of hydrocortisone, check it again, it's 32. In other words, their body's sucking it up. They're not suppressing anything. They need it. Oh yes, and by the way, within about 4 or 5 days of giving it to them, you're a hero. All of a sudden you're a genius. Lots of aches and pains, lots of problems go away when you address adrenal function aggressively. Metabolism. I'm huge on metabolism. I've published quite a few papers on it. I have some patents on devices that measure metabolism and everything. Everybody comes to my clinic, I check their metabolism using an oxygen uptake system. And guess what? Guess how many people have normal metabolisms? Whole one. Never seen anybody with cancer of any kind, even a lumpectomy type of cancer, and I'm not talking just the stage 4s, have a normal metabolism. It's exactly what Dr. Tennant was talking about. He's talking voltage, he's talking metabolism. That's where you get your voltage, through your metabolism. Okay? So, yeah, nobody has normal metabolism, but that gives you a nice objective thing that you can look at and then start to administer therapies for. I've tried all kinds of nutrients over the years to bump metabolism. Besides the obvious things like amphetamine and coffee and Red Bulls and stuff. The only thing nutritionally that I have found that will do that is B vitamins. So it's routine for me to give my sick patients the Myers cocktails, just loaded with B vitamins and some magnesium. That's something all my chronic Lyme patients are going to get probably twice a week. I think it's really important. Oxygen therapies, Dr. Tennant mentioned these things. Exercise is number one. Of course, most of these people can't exercise. They don't have any exercise tolerance, which is part of the problem. In terms of prevention, you guys just stay in tip-top cardiac shape. You know how many patients I've seen that are in tip-top cardiac shape that get sick? How many patients have you seen? They're like in awesome shape. You come to your office and say, oh, I got Lyme disease now. Unless they're overtraining, that just doesn't happen. So keep yourselves in really good shape. You can do exercising with oxygen therapy. That can be really handy. You can do HBO like Dr. Tennant does. This can be really handy. Thyroid is huge. And forget the tests. Do not, if you're diagnosing you're diagnosing any hormone deficiency with a test, you're behind the times. Tests are useless. Why? Because everybody's so different. And because with the test, you're only measuring the hormone. You don't know what's going on at the receptor. That's a whole nother deal. You don't have a clue. So forget diagnosing any hormone status by a test. It's a clinical diagnosis. If they're clinically low in thyroid, you give them thyroid. Now with me, I get to measure metabolism. Thyroid regulates metabolism. So if their metabolism is low, guess what? I give them enough thyroid, and I keep rechecking their metabolism, and I keep pumping it until they get normal metabolism. That might be at 3 or 4 grains of thyroid. You probably never think of doing that. But I do it because I can measure the metabolism and see the effect. And my patients will get well then. So thyroid and DHEA, those are 2 partners, by the way. They work really well. The adrenals, low-carb diet, drugs. I got a cool slide to show you on drugs. And mitochondrial nutrients. This comes from mitoaction.org. It's a table of reported drugs with mitochondrial toxicity. Get ready to have your minds blown. This is all in the literature. I don't know if you can see this, but so you got anticonvulsants, valproate. And then over here it lists the action. Over here it lists the symptoms. These are all mitochondrial. These are published, black-labeled mitochondrial suppressants. Mitochondrial means it suppresses your voltage. It suppresses your mitochondrial function. How about the antipsychotics? Guess how many of my Lyme patients are on antipsychotics? Just about all of them. You got antidepressants, all of them. Okay, so all those patients come in on their antidepressants. You got your antipsychotics, your barbiturates, anxiety medicines. You got all your GABA medicines, alprazolam, etc. They're on all this stuff, by the way. No wonder they're not getting better. The meds are poison, half of them. Statins are just a gigantic mess, and that includes the bile sequestrants as well. They're all a mess. They're all mitochondrial inhibitors. That's a pretty long list, right? It's not all of it. Now we get into the NSAIDs. Oh, antibiotics. Antibiotics are mitochondrial suppressants. Any reason why can you start to see a little bit why my chronic Lyme disease patients don't get well when they're on 5 of these drugs? Got to get the drugs out of there. Diabetes medicines, metformin, beta blockers, immunizations, antiviral drugs, antiretrovirals, all, of course, obviously chemotherapy drugs. Okay, so that's just a ditto on that. I love this quote. Sir William Osler, he's considered to be the father of modern medicine. All my conventional colleagues out there, that's our guy. One of the first duties of the physician is to educate the patients not to take medicine. So one of my first jobs as a doctor is to get you off your darn medicines. Now, fortunately, a lot of people that come to see me come for that reason. I saw a guy the other day, he came into my clinic, just an old guy, he's walking like this. And his daughter came with him to speak for him and said, you got to get him off his medicines. They put him on his medicines. This guy's like a zombie. So think of it. Get him off the darn medicines. It's one of our first duties. It's what you have to do. There's a bunch of mitochondrial nutrients. I'm not going to go through all these because I don't have that much time. But these are the ones that I found to be very helpful. And you guys have the slides, right? So it's on there. Okay, I want to just make sure I get this one out. Neurotransmitter therapy, absolutely indispensable. Until I put this in, nobody got well. That's how indispensable it is. That's thing number 1. Thing number 2, neurotransmitter testing, complete waste of your time. If you're checking dopamine levels, serotonin levels, and I don't care what you're checking, whether you're checking platelets, you're checking whole blood, you're checking urine, I don't really care. Absolute, complete, utter waste of time. They don't help you. A high dopamine level does not mean they have too much dopamine. It might mean they're deficient. I don't have time to go through this, but it's a biphasic curve. Too little shows up high. Too high shows up high. They're useless. How did I figure that out? Because I did them for about 2 years. I figured this is useless. It never does anything. And then Marty Hinz came along about 3 years ago, and he taught me why they're useless. So there's a reason why they're useless. I highly recommend you take Hinz's course on neurotransmitter therapy. It has done more for my practice probably than any single thing I have ever learned shy of ozone and adrenals. Absolutely amazing stuff. And there's the websites, neurosupport.com. He gives regular seminars. He's only published about like 10 peer-reviewed papers, that's all. Amazing stuff. His whole protocol is built around 3 things: tyrosine, 5-HTP, and L-DOPA. It's pretty darn amazing what you can do with these. And once again, you have to think of this. Also think of methyl tetrahydrofolate. That can be incredibly important for these neurotransmitters as well. Remember that every time a neurotransmitter interacts with a cell membrane, it requires a methyl group. Methylation, incredibly important. And then finally, something that has just blown my mind now, and that is this neurobiofeedback system. It's a system that you put electrodes on, you get readings on an EEG monitor, and then the electrodes inject a current back into the head. The computer reads the changes in the EEGs as a result of that current, then modulates the current, and another current's injected, and it does it like 60 times a second. It's a completely passive treatment. The patient just sits there while you get this treatment for 20, 30 minutes. Absolutely amazing. I could tell you stories you wouldn't even believe, but I don't have time. The IASIS is a brand new stuff. It's new computer programs. It's based upon the LENS, L-E-N-S procedure. So there's lots of LENS practitioners out there. So you can look that up. I think it's lensproviders.org or something like that. IASIS is just one-ups the LENS procedure, and that's a brand new thing. Next month's newsletter that I'm writing will have a complete description about IASIS because they're just starting to come out. I've been using it for about a year. I got lucky. It's starting to come out here on next year. Hormonal therapy, like I said, forget the tests. Hormone deficiency is a clinical diagnosis. Men, testosterone, DHEA. Women, I'm going to have to run through this a little bit fast because I'm getting down there. In fact, I'm over. Melatonin, gigantic doses of melatonin. Do not be afraid of melatonin. You do not suppress the pineal with big doses of melatonin, so you can go all the way. Thyroid hydrocortisone, toxicity to heavy metals, especially mercury. That's the worst one, there's no doubt about it. We routinely, on all my Lyme patients, going to do a calcium EDTA, not DMSA, DMPS. That's what I do, DMPS challenge test. We routinely do a UPPA, and between those two, we figure out what's going on. If there's something going on, we'll either use those chelations or we use the quicksilver detoxification method. And I think Chris Shade is here doing some kind of workshop. And of course, avoidance, dental cleanup, fish. You know what are the only two seafoods that really don't have any mercury in them? Get this. Crabs and shrimp. Now, I don't happen to like crab or shrimp, but maybe I'll like it more because it's the only one out there that doesn't have mercury. Some fish, especially the larger ones like sharks, and you guys probably know this, have most of the mercury. There's a lot of mercury out there. And that's it for me, and I pretty much did it on time. I'm going to be around this afternoon. Also, I have to, thank you. I forgot to make my disclaimer. Okay, it says I do have a financial interest in one of the products I talked about. That would be the adrenal product. I have a financial interest in that. It's my product. I don't think I talked about anything else that I have a financial interest in with any company or offering grant monies for this continuing education, dental, and medical education program. So with that, thank you very much for your attention. Appreciate it. Have a good rest of the conference.
Thank you, Dr. Shallenberger. I have some announcements real quick before we break for lunch.